I wanted to have this procedure because as I'm aging, I'm seeing things about my face which I don't mind at all, but I noticed that suddenly this whole area was falling, and it makes me very uncomfortable. I don't recognise myself when I catch sight of myself in a photograph or from the side, and so I'm hoping that with the Simoni lift we'll be able to eliminate some of these drooping areas and also get rid of this whole situation down here, which I'm hoping I can have my jawline back, which suddenly disappeared.
No, it feels that way, doesn't it?
Mm-hmm.
No.
Do you collect them?
I'm sorry?
Maybe you collect ears.
Pick up. The rest of it, you have to tighten it up. It's not only excess fat, it's a loose tissue too, so you kind of...
I already see a huge... I'm sorry, dear. My name's Dr. Chu. I'm working next door, but waiting for my case to start.
No problem.
I love watching Dr. Simoni with his face lifts. He does quite a nice job.
Thank you. He's an amazing body surgeon. He's amazing.
I've been looking at all the new breasts I could choose from.
Be more than happy to talk to you.
Yes. Some nice teardrop shaped ones.
The next thing is the neck. We're gonna do... Let me see, I need to make sure this comes perfect, because that was the main thing. And that is your neck. You can feel that, right?
Mm-hmm.
I know. Feels so good. You see that? The whole thing can be lifted. Okay. So it's behind your ear. Lift it up behind your ear.
So most of your routine today is to lift the lower portion of the face.
I did actually mid-face too, but she doesn't need a lot of mid-face. So I just created support. Her mid-face was perfect. She didn't have a lot of nasolabial fold, so I created just the support. You can turn it. I think liposuction of the jaw does two things. One thing is actually take the fat out. The other thing creates some bringing in, creating some tightening.
Yeah, as it scars down fibers.
Exactly.
No, I do it all the time with my tummies. That's why I get such good curvature.
This is getting the fat off the neck. Feels good, right? This is actually the most fun for everybody when you suction the fat out. I know. Everybody loves it. Everybody says that nobody minds getting the fat off the face or everybody in the body.
Maybe I'll have a chicken gap when you're finished. Maybe I'll have a jawline.
You're getting your jawline now. This is actually giving you a nice jawline already. You just have to keep it a little more tighter. That's all there is.
I'm going to like with the little cheeky jowl bits too.
Yes. Well, it's almost out. It's in the tube now. That disgusting underneath your neck is in the tube now. We're just going to get lifted a little bit and we're done. We're going to do a little bit of your jawline. It gives you kind of more sculpture there.
Yeah. Okay. This is now a week later, and now I look in the mirror and I get to see myself and the face I expect to see when I look in the mirror, instead of that old woman who was looking at me before. And I feel great now a week later. That's it.
We are 8 days out. We had a little bit of liposuction, which is a little bit swollen. This is the incision after 8 days. very nicely healed. She looked beautiful. Here, the incisions are healed very nicely. Couple of sutures that we're going to remove today. We haven't removed. The jowls, beautiful. She doesn't look pulled. She doesn't look done. She looks very, very natural, the way she should. She doesn't look like she had a facelift done. Everything nice. The lips and everything looks like the perfect shape. The lips doesn't look pulled. The jowl and everything is in the right, perfect position. She has a little bit swelling here, a little bit behind the ear, a little bit here, maybe tiny bruising. I'm not sure even if it's bruising or just the skin color, but she did very well. She didn't bruise at all.